Hello, everyone. It is Bisa Dobson. If you don't know me, I am one half of the Conversationally team, and I'm here today because we are doing a live interview with the co-founders of a wonderful new program called My Body, My Friend, which is a a mindfulness-based practice to help people do lymphedema self-care better, particularly women do their lymphedema self-care better. So I'm going to take a few moments to introduce them. We're going to get going tonight, and if you stay to the very end, there's going to be a special treat from the team behind My Body, My Friend. So make sure you stay to the very end to watch. So I'm going to add the first person to the stream and introduce them. That would be Dr. Lucinda Sykes, one of the co-founders of the program. I'll read a short bio about her before she speaks about herself. So, Lucinda Sykes is a medical doctor, and has been a director of Toronto's Meditation for Health Clinic since 1997. She's provided medical programs on mindfulness for more than 6,000 patients referred to the clinic. Currently, her special online interest is non-medical programs that support women living with sleep concerns and life-changing illnesses. Lucinda is active as a board member for the Canadian Neurovascular Health Society, and her co-founder in the program is the lovely Ms. Pam Hammond, and she is a lymphedema therapist, registered massage therapist, and also a shiatsu therapist, who we don't often mention. And Pam's history is that she is a Dr. Vaughter certified combined decongestive therapist, a lymphedema therapist in common parlance. She has a private practice in downtown Toronto and previously worked at the Princess Margaret Cancer Rehabilitation and Survivorship Clinic for many years. She's also co-chair of the Canadian Lymphedema Framework Education Working Group. So welcome to you both, and thank you for being with us tonight.
Very nice. Thank you, Bisa. Thank you.
Thank you. So we wanted to start things off because I'm sure a lot of our audience and listeners don't know anything about you. So we want to give you a chance now to embellish, add on to the introduction that I did for you, to give you a few moments to talk about yourselves and the program.
Yeah.
Who wants to go first?
Well, I don't know. Pam, would you like to go first?
Why not? So, Bisa, thank you for that introduction. I don't have a lot more to add, except that I also really love teaching. So when since I've been a therapist, I've always worked in private practice, but I've also worked at Sutherland Chan Massage School and Teaching Clinic, and I taught there for many years. I was an instructor and also a supervisor of the student clinic, and also supervisor of many outreach programs that were really, really interesting. I actually, at Sutherland Chan, was the first time I was introduced to working on at Women's College Hospital in a breast cancer clinic. So that was very exciting. I also have studied quite a bit with manual lymph drainage, but I have, besides teaching at Sutherland Chan, I also taught at Princess Margaret, as you know, and my passion for many, many years has been working with people with lymphedema. So I'm really excited about this program. Lucinda and I have known each other for many, many years, and we feel like our skills complement each other very well.
Okay. All right, Dr. Sykes?
Yes, I can attest that Pam is a wonderful teacher. We have taught in the past, and I'm really glad to be teamed up with her again in this project. We've been talking about it for some time, and at last it's come to fruition. As you were mentioning, Bisa, I have been teaching mindfulness for many years here in Toronto at Meditation for Health. We've had a whole range go through the program, all referred by their doctor for a range of illnesses, both physical and at the psychological end of things. And mindfulness is a powerful practice. There are hundreds of research studies now that show the value of mindfulness, again, for this wide range of problems, conditions. And most definitely, mindfulness has been shown to be helpful for people who are living with chronic illness. And again, that's a pretty wide range of problems, isn't it? But especially for people who are having to, care for themselves. They're not just passively, being ill and getting on with things, but they're actually having to care for themselves. And Pam has been telling me really again for years of the special challenge posed by lymphedema and especially the self-care. And she and I both thought that mindfulness would be a wonderful addition to self-care management. So I'm so glad to be here.
Fantastic. Okay, so you've kind of answered the first question, but I will ask anyway to see if there's anything else you want to add.
Yeah.
How did this program, My Body, My Friend, that you're about to start a new round of in September, how did it come to be? What was the inspiration? What motivated you to get together again to do it at this moment?
Pam, did you want to venture with that? Pam has been my great inspiration.
Oh, your mic is muted, I think. Yeah.
Have known each other for many years, and we've talked about doing this program for many years as well. And I think the inspiration was that we both feel that mindfulness-based meditation and body work just fit together so perfectly.
Yes.
And we also feel, because we've been working for years and years, I know for myself, I think because of a lot of the teaching that I've done, I feel that I can really help people to manage their lymphedema in a way that's right for them. Lucinda is going to do the mindfulness part, and I'll let her speak about that because that's her expertise. But I feel with me, some things, many people say that when they do self-massage, it can make their unaffected arm feel painful, or, if it's their legs, both arms, their body's uncomfortable. And because massage, exercise, and body mechanics just work so well together, and being a massage teacher for many years, I've had to work with people with body mechanics. So, seeing a participant and working with them to help support their body mechanics so that they can relax their hands and actually feel what's going on in their body and have that embodied sensation. I think, when you do self-massaging yourself, which I have done, and when I had an injury, I did self-massage, when I can actually feel that tissue move. And I know just amount of pressure to use, as does anybody that's doing massage themselves. I think those are the things we often don't have the time to teach in a hospital setting.
Okay, so those are the kind of things you're going to impart, the kind of knowledge you're going to impart in the program. Dr. Sykes, do you want to?
Yes, and mindfulness-based body awareness fits right in there, doesn't it, Pam? Mm-hmm. And as well, I'll contribute that often the challenges we face in self-care is the habits of the mind, shall we say, a habitual attitude to ourselves. And sometimes, especially if we have, had a brush with life-threatening illness, and we're dealing with life change as a result of change to the body, the mind can get preoccupied with the past, remembering how things used to be, fear about the future, disapproval of things as they are right now, self-judgment, and so on. And in this way, the mind can actually be a burden. And through the practice of mindfulness, we can kind of get through that or past that and get to, shall we say, the deeper level where the mind wants to serve us. We can call up the inner resources, shall we say. We like to say that at MBSR, that mindfulness gives us access to our inner resources, even, dare I say, our inner wisdom. And it's not that we're going to change our mind. Folks, mindfulness is not about changing the mind, but it is about adopting the mindful attitude to the mind, in which case it ceases to be such a burden. So we'll be getting to that for sure.
Awesome. So we're looking at the mind and how the mindset can influence what's happening with your body in the program. That sounds really
yes.
Well, and I think it feels like it would be empowering for people to learn that and shift them in really positive ways. So that's really great to hear about the program. All right.
May I just add in, Bisa, you probably know yourself working with people, we hear so many people criticizing themselves, and that's really painful. And yes. So what Lucinda has to offer is just so welcome.
Yes, as a therapist, I have to say I do a lot of cheerleading, I'll say, for my patients. Because I'm like, you were doing what you knew before, and now you know something different, you can do better, and let's be positive and move forward. So
yes,
this program sounds like it's going to build on those kinds of ideas, which is really great.
Yes, and mindfulness, I would offer, is so beautiful because we don't need to change the mind. Such an effort to improve our minds, goodness sakes. Instead, we're just going to allow the mind to happen as it does, but our attitude will be a mindful attitude. And we'll be getting to that. Really, that's the gist of my end of the program, in fact.
That sounds great. And based on that, I would love to know, and we would love to know, who this program is specifically designed for. So when you developed it, who were the people you were thinking of helping, and who need the help most as far as what you've seen out there in your respective practices?
Well, I must say, I've left it to Pam.
Okay. Really? Please, Ms. Hammond. Take it away.
It's her practice. Yes, she knows who's best going to benefit here, and then I'll bring in the mindfulness. Yes.
So the people that we want to serve are the people that have lymphedema, are living with lymphedema, but are not satisfied with the way they're managing their lymphedema. And again, a lot of that rolls into self-criticism, not doing good enough, and then giving up. So we know, we feel for these people. And I think as I do all of us. And so that's where we want to really be able to have the skills to be able to say, okay, let's practice these skills, but with a mindful attitude. And that's what Lucinda will bring in. So it's really a two-prong, and we'll be working together on this all the way through.
Okay. And I know on your website and in the advertising we did for you, it was specifically geared to women. Let's say if a gentleman wants to come, I'm sure he'd be welcome in the space. Will there stuff that will be particular to men as well, or is it mostly geared to women primarily?
I think we welcome them in. Yes, yes. I must. It's probably just a habit, because that is my practice. Is I work with women, specifically. Much of the time, I'm working with women over 50.
Okay.
And helping them to sleep, in fact. So mindfulness really has a broad application. So I think that the emphasis on women is a kind of natural outcome of my particular practice. But gosh, if there are some men in the audience, you will be welcome.
Welcome.
Fantastic. So this is open to everyone and designed to help anybody with lymphedema who wants to upgrade their self-care.
I have served many men through the years. Yeah.
Fantastic. Good to know. Okay. So we've covered who can attend. So what is the cost of the program?
Lucinda, do you want to take care of that?
We have an early bird price of $125 until next Tuesday.
Okay.
So if you sign on before then, our price is $125. We go up to $195 after Tuesday. And then, of course, we begin on September the 7th.
Fantastic. Okay. And this is a virtual program. How many weeks does it run for?
Well, there will be 5 Wednesdays and 4 Sundays. So we end just before Thanksgiving.
Excellent. And it's all online. There's no in-person component.
I'm sorry, it's all online.
Virtual. There's no in-person.
Yes, we're Zoom. And as well, all participants will have access to recordings that they can use at home for the home practice, which is part of the mindfulness training. So the website of Meditation for Health, we have a number of different recordings there, and everybody will have access to them. And gosh, we'll leave access after the program is over too. If they find them useful, they'd be welcome.
And so you have an hour on Wednesday, hour on Sunday. Let's say I join and I miss a day. Will that be posted so I can see what I missed as well?
Sure. Well, it's an hour and a half, isn't it, Pam?
It is an hour and a half. And all our Zoom programs will be recorded, and people can watch them whenever.
Okay.
Yes.
All right, fantastic. And the last question I'll ask regarding this, as far as who can attend, this is international. Anybody who can come at the time it's happening can watch us and join in, because it is a virtual program.
Yes, and the payment is in Canadian dollars, so that may be of interest to our American friends.
And European who are dealing with dollars a little stronger. Okay, so I just wanted to make sure people understood that. And I think I saw, please correct me if I'm wrong, I'm going to ask because it's important. I saw something about a money-back guarantee, because I think that's important to mention.
Yeah, we want full happiness. We want full happiness. And if at the end of the program, you don't feel that you have benefited from this program, well, gosh, everybody is invited to a before and after individual meeting with either Pam or myself. And you can tell us at the follow-up meeting that you didn't find it useful. And I know Pam would join me in this. We will be interested and we will refund you your money.
Absolutely.
Yeah, we want you to get something from the program. This is not us shelling to make a few dollars for ourselves. We want you to get something from it.
All
And we
right.
want,
Go ahead, Pam.
and it's going to be a commitment for our participants too, to attend 2 Zoom meetings
Yes.
every week. Though that's why we'll have the recordings. But we want people that really want to be here.
Yes, and who are going to practice the mindfulness at home, because that's how you get the real depth of the practice. So this is a demanding program in this way. Thank you for bringing that up, Pam. Yeah, let's emphasize that. It's not just the money. You bring your awareness, your willingness to engage every day.
Excellent. So this is a program. I'm going to just kind of reiterate what you guys are saying to make sure we understand. So you get a money back guarantee, which is wonderful, but you also have to come as a participant who's ready to do the work of showing up twice a week, doing your hour and a half of work, homework in between, to make sure you're getting the maximum benefit and going to actually see the changes and improve over time.
But we don't want to scare people, because you see, the work is about being aware of the present moment.
Yes.
So I wonder what work means in that context. We'll let people figure that one out.
Okay. All right. And what are your long-term goals for the program? It sounds like a wonderful program. So beyond this first round that we're talking about here, what will happen next in the program, future development?
What do you think, Pam?
Well, I think we are hoping that what we want is people to be satisfied with their lymphedema management. And I think the bigger goal really is what Lucinda is going to bring is remembering our innate wisdom and cultivating mindfulness in their everyday life. Is that true, Lucinda?
Oh, yes. Yes. On one hand, we're very focused on supporting everybody in their self-care, vital. And on the other hand, what we're pointing to, not only in my contribution in mindfulness, but also Pam's in mindful body awareness, what we're pointing to, well, in some traditions, it's called self-liberation, that we become less entangled in the story mind, which is often a little pessimistic or full of regret. And through mindfulness, we get to spend time in our lives when we're just being alive, welcoming the present moment.
And welcoming our body and
Yes.
and enjoying and loving our body again, as we did when we were, it's been our oldest friend and companion all our life, and remembering that.
Well, thank you, Pam. Of course, that's the title of our program, isn't it? My body, my friend. Thank you for emphasizing that. Yeah.
These are beautiful sentiments. I think that will resonate with a lot of people in our audience. So
yeah,
love this program for sure.
Because the body, she's doing the best she can. Okay. Not to leave the gentleman out. Your body too is doing the best he can.
Our bodies are doing the best they can.
Yes.
Everybody involved. Awesome. Okay. And one last question. What is one thing each of you believes that would like more lymphedema patients to recognize about their own self-care, or one thing they had access to that would be really helpful for them? If you could make it happen, what would the one thing you want everyone to know or have access to who has lymphedema to be better in their lives?
Relating to the body through present moment experience, through the touch, rather than the story of my body, how she was, how she will be, am I doing this right, is this going to work? That kind of story mind is so distracting, and we miss indeed the pleasure of being here, caring for ourselves.
Pam, what would you say?
I would say something kind of similar, is that it would be the, like Lucinda was saying, the pleasure of caring for ourselves, the pleasure of being in your body, of feeling your body move and being there. And really, that's our self-compassion, our self-love. Some of our deepest wisdom is there. And so that's what I wish for patients. But I also very much, Lucinda, Bisa, after hearing that question, I'm going to make a point of asking that to each and every one of my lymphedema clients, because I want to hear what they say.
Yes, definitely. I think you probably get some very, very a wide range of answers, but also some very
Yes.
consistent ones as well. Yes. All right. All right. So, is there anything else you'd like to add before we move into the special treat for the audience that you have?
Do you want me to stand up and show my T-shirt? Okay.
No, that's not necessary. You're very kind. You're very kind. Pam is always plugging everyone. It's so lovely. Okay. So,
She loves the t-shirt. She was telling me what a nice t-shirt. She said,
Pam happens to be wearing one of Conversations t-shirts. That's for the audience who can't quite see it. Okay, so now that we've done the formal question section of this interview, we'd love for you guys to do the meditation. I'm not sure who is going to lead it. I guess it'll be Dr. Sykes.
oh, yes, we could have a brief experience of mindfulness.
Yes.
Certainly. Yes, yes.
Okay.
Welcome to the present moment.
Mm-hmm.
And what's so powerful about mindfulness is that, in a way, we're already mindful. And so what I'll be doing is pointing to that. And I'll offer a few simple instructions, but we're not going to try to make ourselves mindful. We're going to remember that we are. So probably useful to close your eyes, or if you prefer, you can just look down towards the table, perhaps, that's in front of you. But most people, especially for a brief practice, would like to close the eyes. And then you may find as you do so that in a way it's easier to come in within oneself, so to speak, this sense of being here. Do you notice that you are here right now? This moment is happening, and you probably have a sense of sitting. Maybe feeling your feet on the floor or perhaps crossed, and you feel your pelvis, your hips in the chair. How about your hands? How are they resting right now? And then, of course, there's your shoulders and your face. Would your face like to relax? Yes. Maybe a little swallowing is happening, feeling your tongue. And for sure, you feel yourself breathing if you pay attention. There you are, breathing right now. Sitting, breathing, swallowing, being here. And this is what we call mindfulness, being aware of this present moment happening. And of course, there's some thinking going on too, I would guess. You find yourself even thinking about the fact that you're sitting and breathing, thinking about my words, and you are aware of thinking and sitting and breathing. Maybe there's an emotion happening. Do you notice that possibly? Or a little mood or a feeling? A whole range of inner sensations possible. Want to use the restroom or get a glass of water, or noticing how warm the room is. And we're being here with feelings and emotions and thoughts. And then again, the whole range of sensations that happens because we are this body sitting here. And nothing special needs to happen because there's so much happening if we pay attention. The thinking and the feeling and the breathing and the sitting too. And because we're modern human beings, probably a lot of thinking about the moment. What am I going to do later? What does this mean? I'm feeling this. And so on. This is the modern mind. And behind it all, beneath it all, this deeper sense of just being here. I'm just being here right now, sitting, and I could even for a short while focus on breathing. That's always available to us. Do you notice the feeling of breathing? There's no correct way or better way. Almost always we can feel ourselves breathing at the face. Do you notice that in some way? The breath is entering your nose or releasing, or possibly you have obstruction at your nose. You're breathing through your mouth. But whatever the sensations may be, do you notice how the in sensations are so different from the out sensations? Sure, but breathing involves the whole body in a way. How about the feeling of the chest? Do you notice your chest is somehow involved in breathing? It's not always. Maybe you're going to your chest and there's no sensations of breathing. Or possibly you feel your chest expanding with the in-breath, relaxing with the out-breath. But nobody needs to tell you about it. It's your direct experience that we're interested in. So my words are simply pointing to this that's already happening. Your feeling of being here and breathing, feeling the chest. Sometimes we even feel the lower abdomen involved in breathing too, but there's no goal to it. We're just sort of visiting different regions of the body and feeling breathing. And the breath might be slow or faster, or maybe it's very steady, or maybe it's sort of irregular. Some breaths are deeper and others more shallow. Yeah, it all gets to happen in this moment, just being here. And this is mindfulness. And again, you could just notice maybe thinking about it. Isn't that interesting? There's the direct physical experience of breathing. And then oddly, we can be thinking about it. It's a different experience. The topic of thinking about breathing is different than the sensations. So this is all mindfulness. And I'm going to end us in just a moment, but I don't want to rush us. Let's just have just a few seconds where you can be present to yourself as you are. And dare I say, your body's doing the best it can. And you're just being here as though for the first time. And there we end our practice.
All right, that was lovely. Thank you so much for that treat. I need to get a guided meditation more often. So beautiful. So one last thing before we go, I'd like you to again to tell people when the program is starting, what days they would need to be present, and how much it costs one more time, just to make sure everybody knows that, and where they can sign up, most importantly.
Good. I appreciate your organization. Isn't that beautiful? Yes. Pam, you can. $125, isn't it?
Yes.
And we start on the.
Mic on, Pam. Thanks.
Is my mic not on?
Yes, yours is on. Pam wasn't.
Okay. Yeah, we're $125. If you want to get the early bird, you go to the website, which is mybodymyfriend.com. So go right there to mybodymyfriend.com. There's the requisite red strip that says if you click there, it'll take you to the order page, and then you can use your credit card to sign up for the early bird price. I do hope you do so. But if you forget, and you're still very welcome to join us at $195, which is still, I would offer, a pretty good price, because you're going to have a chance to meet with Pam and myself before and after the sessions, and then there'll be the 9 group sessions. And gosh, we hope you're willing to practice at home too. So it's going to be pretty intense. Yeah.
Intense and awesome.
Yeah.
Intense and awesome.
I like that.
And mindfully in the moment.
There you go. All of that. All right. So I think we are done. Any last minute words you guys want to say? Last things you want to add?
I've just really enjoyed meeting with you. Really.
It was lovely meeting with you. I have to say your voice is so soothing. So I encourage all of our audience, those who can, to jump on this. This is a great deal, and I think it'll be a great program that will help you up-level your self-care and really be in your body, be present, and know some new ways of doing things you've been doing for a long time so you can make it better for yourself.
Wonderful. We really look forward to meeting people, for sure.
We do.
All right. Well,
And thank you, Bisa.
You're so
Thank
welcome.
you,
Thank
Bisa,
you
for
both
this
for coming.
invitation.
Great interview and for the meditation. We really appreciate it.
Good.
And have a wonderful evening.
Thank you. You too.
Thank you.
Okay. Bye-bye.